Chapter 12, the Therapeutic Environment. Chapter Objectives. The term therapeutic environment, or milieu, describes an actual setting or an environment that is made to help the client replace inappropriate behaviors with ones that are more effective both personally and psychosocially. The principles of treatment for these individuals are based on the concept that every time they interact within their environment, there is some therapeutic potential. Physical surroundings need to be pleasant but safe. The activities are structured, and the clients are expected to participate in the treatment. Therapeutic milieus can exist in a hospital or a community setting, even a home, but most of the environments require specific limits and controls. These types of requirements are most often located within an inpatient environment. Therapeutic psychiatric nursing practice has moved from custodial care to the management of complex and therapeutic environments. Nurses are now required to manage the client's environment, implement therapeutic interventions, coordinate and integrate multidisciplinary care delivery, as well as evaluate the outcomes of the treatment with each client. Crisis clients will undergo intensive counseling designed to help solve their immediate problem. Some medications, such as antidepressants or sedatives, may be prescribed. Basic stress management techniques are taught to help modify any stressful behaviors. These can be cognitive relaxation and behavioral therapies that are often used to help the client. The goal of inpatient crisis therapy is to assist the client in successfully coping with the crisis. Admission to an inpatient psychiatric unit is a very emotional experience. Those that are admitted involuntarily or involuntarily often may experience an intense discomfort during the first hospital admittance and stay. They may have a sense of failure on subsequent admissions. Hospitalizations can actually dehumanize the individual. Oftentimes, personal items are removed, and staff members often remember the diagnosis before they remember the actual client's name. Many of the mental health problems are associated with some degree of chronicity. Chronicity are long-term and persistent difficulties. People with chronic mental disorders may have periods of relative comfort, and then they may fall into acute psychiatric states. These individuals are actually coping with the unknown, and this uncertainty can be extremely overwhelming. As a nurse, we need to allow our client to take some control of the environment by offering a choice or maybe explaining the unknown. With recidivism, the client may feel like a failure, and the givers that provide care can become frustrated because their efforts were not successful. For a nurse to relate well to the client, they need to accept the client for who they are, because they are actually doing the best they can at this given moment. The nurse needs to learn about the client and their life outside of the inpatient setting and explore after discharge resources that are available for the client in their community. Also, a nurse needs to maintain a positive attitude because clients will do better with encouragement than with discouragement. A treatment team is composed of many specialists. They're all assigned to work with the client. On admission, a thorough assessment will be performed and a therapeutic plan of care will be developed with the client. Nursing staff are more involved with direct care and management, but all members of the team will communicate, collaborate, and teach. Maslow's hierarchy of needs is something as nurses we consider when we're looking at our clients' needs. So everyone has basic self needs, which are the physiologic needs: to breathe, have clean air, hygiene, food, and shelter. In a controlled environment, the client will actually have an opportunity to help explore their feelings and learn more effective behaviors. Part of controlling the environment is providing a safe and secure atmosphere for the client. We can do this in many different ways. One way that's vital is we do what's called limit setting. This helps keep the actual environment consistent and predictable for the client. Love and belonging is necessary by everyone. And because the client may be struggling with a mental health disorder or problem, does not take away their need to feel acceptance and to find a place within a group. When nurses communicate what is expected, the clients commonly will attempt to meet the expectations. As nurses, involvement in the process of actively interacting with the environment and the people within it will help provide the client with self-esteem needs. There are various expectations for the provider of care as well as for the client. So when the therapeutic relationship ends, the expectations of the provider are that the client can use their own resources to deal with a difficult situation, and that clients are independent in their therapy as well as being compliant with their medications. For the expectations of the client, they expect to be cured of the illness, and they expect to have emotional support available from the healthcare team. Clients that follow the prescribed treatment are said to be in compliance. The phrase or term of non-compliance refers to not cooperating with the treatment plan. Assisting clients in complying can be the nurse's biggest challenge, especially when working with individuals that have mental illness.